All right, so Dr. Corell here, checking in on you guys from the Spinal and Sports Care Clinic. We've all been kind of worried about you guys. And this video is about the jaw, but before you close the video thinking this is not for me, continue watching. I encourage you to do that because you might learn something about yourself. So, and it's not any secret that we're all under a lot of stress right now. And there's different ways that people hold stress in their body or how they manage it or start to deal with it. And some people hold it in their low back and they end up with some low back pain. Some people hold it in their neck and shoulders and they end up with neck and shoulder pain. Sometimes they get headaches. Some people hold their stress in the jaw. And that's kind of more of what we're talking about today. So stress held in the jaw, what can that feel like? How do you know if you're doing that? So one way is you'll feel it. You'll have pressure or tension in your face. You'll get tension headaches in your temporal area. Sometimes you'll have jaw pain, tooth pain, ear pain, all symptoms you might be holding stress in your jaw. Especially if there hasn't been any trauma or damage to your face or your jaw. It could just be stress where you're clenching your teeth. So why are we holding stress in our jaw? That's a good question. Like I said, people hold it in different areas, but a lot of people tend to grit their teeth when they're going through hard times, or they just kind of clench their jaw under high stress levels. Clenching your jaw, you're using these two main muscles here, the temporalis muscle and the masseter muscle, and that's where people end up having their jaw pain and a lot of tension. That's why people get tension headaches in their temples. It's actually a jaw muscle. If you don't believe me, hold your temples, clench your teeth or move your jaw around. You'll feel it wiggle underneath your fingers because it is a jaw muscle and it attaches down to the bottom portion of your jaw. And it's one of the jaw muscles you use when you're clenching. So that's why you might get pain in your head and in your jaw. So what can you do? There's 3 things you can do at home to help with this jaw tension. I do recommend you coming in to get adjusted when you guys are ready to come back into our clinic or when our clinic is ready for you guys to come in for it. We are currently still open and ready for you guys to come and see us when you guys are ready. So what can you do? One thing you can do is just calm it down. Use a hot pack on it. If you have sharp or burning pain, use ice instead. Otherwise, use a hot pack. Only for about 10 minutes for either. Make sure you include the temporalis, your temple, and the bottom part of your jaw here. And the whole side of your face should use a hot pack. Again, for about 10 minutes. Do both sides, even if you only have pain on one side. Another thing that you can do is give your jaw a break. Don't chew gum. That's like clenching your teeth over and over again. Stop chewing gum. Go to the soft food diet for a little while. Usually we recommend about 2 weeks. And that means no beef jerky, no French bread, no steak, soft foods for a while. Give your jaw a break. And then watch yourself for clenching during the day, especially during high stress levels or during high concentration times. Driving, make sure you're not clenching your jaw. Give your jaw a break. Help calm it down. And then reduce further tension on it. So to help do that, you can do a self-massage on, again, these 2 muscles. So going to your temples, again, you can clench your teeth to make sure you're on it, and you can just do either soft, small circles to help relax that muscle, or you can do firmer holds. You can also do that in the jaw on the side of your cheeks here. I would do both at the same time when you're down here. That way you don't push your jaw to one side. And you do this for as long as you feel like you need to. Another way is just try to reduce your stress levels. And there's going to be more stress reduction videos along the way, little tips and tricks and all of these videos. So try to move, get exercise like Dr. Van Dyken had talked about in one of his previous videos. Make sure that you do something fun that you like to do. Get your mind off of the stressor. Do something that's fun that will help relax you. Breathe. Dr. Shirley's going to be doing a video on breathing, so stay tuned for that. Take a hot bath, just try to relax. And just remember that we're going to get through this together. Just like all hard times, this too shall pass. And gosh, we can do this.